Well, dear students, now you have some question answers. Question number 1, you should not keep checking if the bleeding has stopped. Why? Answer, we should not keep checking if the bleeding has stopped because this may damage the clot that has been forming and cause bleeding to resume. Question number 2, why is it necessary to keep away soap from the wound? Answer, it is necessary to keep away soap from the wound because it can irritate the wound. Question number 3, how is an antibiotic cream or ointment good in healing the wound? An antibiotic cream or ointment is good in healing the wound because it keeps the surface moist. It can help body's natural healing process work fast. As dear students, we have started with this point that how we are going to apply antibiotic cream, that definitely we are going to wash the wound and all the area around the wound, and then we are going to apply an antibiotic cream or ointment on that wound because it can keep the surface moist, and further it can help body's natural healing process work fast. So this is the purpose of using antibiotic cream or ointment. But if you are allergic to such ointments or antibiotic cream, and how you will come to know that you are allergic to such antibiotic creams or ointment, definitely a rash may appear. Then what is recommended to you? You are supposed to stop using such antibiotic creams. Question number 4, what should you do if you are allergic to adhesive material used in most bandages? Okay, if you are allergic to adhesive material, you should use adhesive-free dressing and or sterilized gauze held in place with paper tape, gauze roll, or loosely applied elastic bandages. So if you are allergic to such material that is used in bandages, so what you are supposed to do, you are supposed to do, so if we are, or if you are allergic to adhesive material which is used in most of the bandages, then you should definitely avoid using it, and you should try to use adhesive free bandages or thin gauze for the dressing on the wound, or such thing you can use this, because this may irritate your skin, or you may get some rash. In order to avoid such irritation or such rash, you must avoid such bandages which has the adhesive material, sticky material. Okay. You have question number 5. When do you need to see a doctor? Yes, you need to see a doctor if the wound is not healing or you notice any redness, increasing pain, drainage, warmth, or swelling. So these are the conditions that if you find your wound is not healing, or such signs you are going to notice, like which are accompanied by redness. You may feel that your pain is increasing by the time, and drainage, like the bleeding is not stopped, and warmth and then swelling. So if you see some sign, then you must see the doctor and get immediate treatment. Question number 6, what should your first aid consist of? Okay, a first aid kit consists of the following items: first aid book, plasters, bandages, gauze and adhesive tape, antiseptic wipes and cotton wool, safety pins and tweezers, scissors, latex gloves, calamine lotion, clinical thermometer, and analgesic tablets. Okay, our first aid kit must consist of the following items. And number 1, as you know, the first aid book which explains the methodology and how to treat the injured people, then sticky plaster, plastic bandages, gauze and adhesive tapes, antiseptic wipes and cotton wool, safety pins, tweezers, scissors, latex gloves, calamine lotion, the clinical thermometer, and the analgesic tablets like aspirin or paracetamol. And what is the use of these two tablets, paracetamol or aspirin? Because it reduces the pain, it reduces rather the intensity of the pain that we are bearing.